Good evening, good afternoon, everybody. You are in the right spot for Dr. Carpenter's compliance on OSHA that's being put on this evening. So I'm going to pass it over to Dan DeLuca from Darby, so he can tell you a little bit about Darby Dental Supply.
Thanks, Dan. Appreciate it. What you may already know about Darby is that we always have partnered with our customers to keep their supply costs down. But over the past 10 years, we've kind of evolved, and we also built a suite of solutions to help resolve challenges that our customers see and face every single day. Some of those are IT services, equipment repair, equipment installation, full plant offering, implant offering, and more. Maybe the most important thing at this time is that over the past 75 years, our account managers have worked remotely with all our customers. Our customers have told us that they enjoy interacting with our team on a schedule that works for them and for their office. It also eliminates some of the unnecessary foot traffic that you see coming through the office on a daily basis.
So at this point, I'm going to hand it over to Dr. Carpenter. He can kick us off here on OSHA compliance.
Very good. Well, thank you. Welcome to the webinar, everybody. So let's start out with this webinar, which we call an OSHA audit, the most common violations of 2021. I am trained as a dentist. I am president of Compliance Training Partners, and our company deals with dentists, physicians, veterinarians across the country with OSHA compliance. And these are the most common violations we've seen in 2021 in the area of dentistry, of course. And what I'm hoping I can do is show you what we've run into, what OSHA expects, maybe some solutions for you, because you know what, it's really not that hard to be in compliance. Just to give you a little background, I'm not an academician. I actually am, I call it a real dentist. I made my living for a lot of years doing dentistry. My wife's a dentist. Here we are in our office. We've got a regular office just like you, although, it doesn't look quite this nice at the front desk anymore with COVID. We took away a lot of the plants and all the things, but it's coming back. We're getting there. Looking down our operatories, we've got 12 operatories, semi-open design, sterilization lab, a couple M11s there. So we're a lot like you. So what I'm going to talk about today are some practical solutions. First of all, when OSHA comes in, one of the first things they look for is a written hazard communication plan. And some of you know what that is, some of you don't. But let me tell you a little bit about what they expect in the area of hazard communication. First of all, a written plan. This is something that tells people, the new employee, particularly in the office, how things work in this office. How do you find the safety data sheets? How do you read labels on products? What about PPE? What type of personal protective equipment do you have? Where do you get it? And how does annual training occur? And by the way, I just want to make it really clear, this is in no way annual OSHA training. That's a 3-hour-long program. This is a familiarization and going specifically over violations we saw in 2021. So this standard hazard communication, this is called the right to know law. People know it as the right to know law. So basically, it means as an employee, whether you're a dentist, whether you're a hygienist, an assistant, a front desk person, you get to know what hazards are in the office, what sort of things you're working with, how you can make it safer for yourself. That's what this is all about. It really makes sense, doesn't it? It's really kind of common sense in a lot of ways. So what are some of the things that we have to do in the office if we own our own business? We've got to make sure that, first of all, we have a hazardous chemical inventory, and that we have, for that hazardous chemical list, we have safety data sheets for all those things. That's what makes it really great working with a partner like Darby. It's pretty easy. They've got a very good system where you can go online, you can download your safety data sheets, you can do a query, see what you bought for the last, say, 18 months to figure out your chemical inventory. The other thing I'm going to mention right now is the only way all of this is going to happen, you've got to assign somebody in your office to do this. Pick a trusted clinical person, pick a trusted hygienist or a trusted assistant they don't have to be an OSHA expert. They can work with a company like Darby in conjunction with us. It's not hard to do this, but if you're going to do things on this page, if you leave it up to us, if you leave it up to the doctors, it's not going to get done. We need to make sure chemical containers are properly labeled. We need to make sure we have a training program. So that means not just once a year, which of course is required, but onboarding for that new employee that you hire, that new assistant you hire next week needs to be trained. And then having, of course, a written program is required. It can't just be an oral thing. You've got to have a written program. One of the first things OSHA looks for, we see this violation all the time. Now, this chemical inventory list, you might say, well, what is that? It's a list of the hazardous chemicals or materials found in your office. It needs to be updated if you get new products. Say you order a new bonding agent from Darby, you need to have the safety data sheet for that. It needs to be on the chemical inventory list. And where should this chemical inventory list go? It should be posted on the wall and in your OSHA manual. Let me go on to the next slide here. So to label things, I'm going to tell you it's a lot easier than you think. You don't have to put a label on everything. Some people think, oh my goodness, I've got to put hundreds of labels. You don't. You only have to put labels on things that are not in their original container. The products you're buying from Darby, say you're buying a GC product, a 3M product, a Shofu product. Those products come with a properly designed, approved GHS label on them. Where you need to do this secondary labeling is if you're putting things like in this picture in an unlabeled container. Probably only about a dozen places you need to do this in your office. These are labels you can get from Darby. In some typical places you might put them. What about your ultrasonic, your enzymatic ultrasonic solution? Comes in a bottle, it's labeled. Now you pour it in your ultrasonic, it's no longer labeled. Okay, so you need to put a label on the device or on the wall behind it. Again, it's on marked containers and employees need to know how to read these labels. And so what's hazardous in your office? I like to say pretty much any powder, liquid, or paste you have, your disinfectants and cleaners and impression materials and restoratives, all have some level of hazardous material in them. Now, employees also need to know how to read these GHS labels, and typically they have product identifiers on, like this. They have contact information for the manufacturer, and you probably have seen these signal words. It's either going to say danger or warning. That way you know just how careful you should be. For example, danger is the more severe hazard. If something had, say, glutaraldehyde in, it would say danger, contains glutaraldehyde. If something had something a little safer like isopropyl alcohol, it would say warning, isopropyl alcohol. And then you'll also have these pictograms that let you know what the hazards are. They're pretty intuitive. They look a lot like this. Here's the 9 pictograms. The bomb going off is explosive. The skull and crossbones is toxic. And these are the things that employees need to know how to read, how to interpret these labels. Now, for training, I'm going to tell you that it's required by law. And you know, I like it when I can talk to doctors alone, because if you get a doctor that says, you know, this is really kind of silly, I don't have time for this, I'm going to tell you, do it to protect the liability of your business. Don't allow employees to hold you hostage because you're not in compliance. Annual training, written programs, it's not that hard to do. It really isn't. And in the future, there'll be some webinars from Darby that will show you just how to do that in terms of annual training. So I always say, have a compliance system, write one yourself or buy one, but have one, because they will look for a written plan. Now, another violation that we see, I call it the second violation, number 2, that we see very consistently, is missing safety data sheets or poorly organized safety data sheets, or people have the old MSDS, material safety data sheets, which are actually obsolete now. So really what you have to do is you have to either have them organized in alphabetical order in a binder like this. This is kind of the good old-fashioned way. You download them from Darby, you print them, you put them in order. I love this system. Even though I was always, for the last 10 years of practice, certainly paperless, I like to have data sheets where people could get a hold of them in the event of an emergency. The only other acceptable way that we found is if you download them and put them on, say, a dedicated laptop. So in other words, your plan can't be, we have an accident. We need to look up an SDS sheet. We go to the Darby website. We try to find the product. Maybe it directs us to the 3M website because the product came from 3M. That won't fly in an inspection. So have your data sheets either downloaded on a dedicated laptop or have them in paper and maintain them long term. The requirement's actually 30 years. So let me just move this ahead. Violation number 3, not having an eye wash or having one that's not accessible or functioning, or it's not being inspected weekly as it should. I bet right now if I went in any of your offices, you've all got an eye wash, probably. But just keep in mind some of the basic things OSHA is looking for. First of all, it needs to be within 55 foot of any chemical hazard. That means most offices just need one. You know, in the central area in your office, not too many offices are bigger than 110 feet. If they are, you need to have a second one. Need to be inspected and activated weekly. So many times in an inspection, an inspector turns on the eye wash, the caps won't even come off. It's all full of sludge, kind of brown sludge, and they won't even function if you don't activate them. The actual requirement is that it needs to be documented. They're inspected and activated weekly. And you might say, well, that seems ridiculous. That's going to take a lot of time. We're talking 30 seconds. Somebody's assigned to do it once a week. They turn on the water, pull the button. I'll let it run 10 seconds, done. Another violation that we see is not offering exposed employees the hepatitis B vaccine or not having a signed declination for the people who don't want it. You're going to get a lot of people who say you get to hire a new employee, a new hygienist. You say, we'd like to offer you the hepatitis B immunization. Oh, I've had that years ago. I don't want it. Okay, that's good. But what they have to do is either give you a documentation of the vaccine, in other words, an immunization certificate, or they need to give you they need to sign your declination form saying that they do not want the vaccine. You've got to have one or the other in their medical record. That's something that OSHA will look for. Just to give you a little background, we all know hepatitis B, it's a virus. It can cause liver damage, death. Remember, it can survive outside the body for a week, so it can live on your dental unit for a week. That's why OSHA takes it so seriously. Very transmissible, 100 times more transmissible than HIV. And of course, it can't be cured, which is why immunization is so important. So we all know it's super effective. I hope someday the COVID vaccine turns out to be like that, where we actually know how many we need. We know with the hepatitis B vaccine, right? We get 3 of them, and we appear to have very long-term immunity, possibly lifetime immunity. And if employees ask, a booster is not recommended by the U.S. Department of Public Health. This vaccine has a very good long-term immunologic memory. And this is the actual declination. It needs to be verbatim like this. I believe CareStack is probably going to post this webinar, so if you need this language, you can get it. And you can always call Compliance Training Partners, we can get you the language. But it needs to be like this, simple things that OSHA looks for. Another one, I've done literally hundreds of OSHA compliance webinars over the past 2 years. And I find consistently only about 15 to 18% of offices provide baseline TB testing for employees. It's a one-time thing that doesn't need to be done every year. If we all worked in a hospital, it would need to be done annually, but we just need to do it one time. That's why I say really try to form a relationship with an occupational medicine clinic in your community, send the employee in. It's probably only going to be $25, $30. Of course, TB, it's a lot like COVID in that it's airborne, it's not bloodborne. So our concern is droplets from coughing, speaking, laughing, sneezing, or of course, aerosols generated from the high-speed handpiece or ultrasonic. Remember, with TB, there's two types of, here I am, I cough with the TB slide. Two types of TB conditions. There's either latent TB or TB disease. And of course, in latent TB, the bacteria are in the lung, but they're not reproducing. The patient is not infectious. Whereas TB disease, the bacteria are actively reproducing. The patient is very infectious and typically symptomatic. They can't be treated safely in your office, where a latent TB patient can. We had a case a couple years ago where an employee came up with a TB positive test, a new assistant. Well, what we had to do was we had to then have her go to a physician. She couldn't work for us any longer until she was cleared. If she had latent TB, she was not infectious, she could work. If she had TB disease, she couldn't. So of course they did a chest x-ray, a sputum analysis, determined she had latent TB. She came back to work safely then while she was being treated. Common symptoms: fatigue, fever, weight loss, night sweats, chills, chronic cough, a productive cough, coughing up blood and mucus. So a lot of things sound a bit like COVID. We fortunately are in a low-risk facility. So again, we only need to have a TB test as a baseline one time. So to prevent transmission, again, get a baseline test for your employees. Make sure that everybody, including the front desk staff, knows how to recognize TB patients. And of course, we've become all of us particularly aware of respiratory disease during COVID. And if anybody has any of those symptoms, we're not going to treat them. We're not going to have them in the office. So, and of course, have alcohol hand rubs, tissue, no touch receptacles in the waiting room, all of the things we're doing for COVID. Now, another one that we saw every year, but we seem to see a lot last year, was not providing training. I mean, you could have a good office doing a lot of good things, but not providing training. So again, I want to impress the need to do it at the time of initial assignment, the need to do it annually for all staff members. A typical thing that we see our clients do, which, for example, Darby clients, Darby works with us, is to do an annual training session, probably with online training modules that they purchase from Darby, one for each individual. That way they're able to prove that they've been trained. And then if that new employee comes along, they have training codes to give them. They can be trained as part of the onboarding process. And remember, that's why it's really important to have a documentation of training. After these online trainings, they can print out a certificate of completion. Make sure, insist that they give you, or give your office manager, whoever's in charge of OSHA, this proof, because this is one of the first things OSHA looks for. They want to look for training records, and you have to keep them for 3 years. So make certain that you keep these for at least 3 years. You can imagine post-exposure treatment is really important. It's super important because you can dramatically alter the potential transmission of disease by having proper post-exposure protocol and counseling, to an employee who's exposed. So let's talk about this a little bit. Let's just say somebody had a needle stick, a scalpel blade cut, a splash of blood into the eyes. Well, post-exposure evaluation needs to be made available if this happens to anybody, and it needs to be done cost-free. Again, I'm really going to ask you, Google up, or have whoever's in charge of OSHA, whoever you're going to put in charge, occupational medicine clinic, Bethesda, Maryland, or wherever your practice is. Give them a call. Let them know, hey, we're a local dental office. We need to have a place that can do our hepatitis B immunization, that can do our baseline TB test, and that we can send an employee if there's an exposure incident. And the great thing about an occupational medicine clinic, they're reasonably priced, and typically they understand how to do proper post-exposure treatment, which really would be the rapid hepatitis B, hepatitis C, and HIV test, and then of course any follow-up that needs to be done. The other great thing is a fellow business owner, they know how to bill your workers' comp insurance, okay, because it's a on-the-job injury. So something that happens in the office, kind of a dramatic picture here we took. So you wash the area with soap and water, notify the supervisor, maybe the office manager, and whoever's in charge of OSHA. And of course, if the nose or mouth were splashed, somehow they didn't have a mask on, flush it with water. If the eyes were splashed, I'd use the eye wash, irrigate for 10 minutes using the eye wash. And of course, now it's time to pull out these written incident reports. And I'll tell you, so many inspections start when an employee is upset because they don't feel that they're being taken seriously or being treated properly after an exposure incident. So have your forms ready to go. A form for the exposed employee, a form that the patient would fill out, and a form for the occupational medicine clinic. And this is going to document the who's and what's and where's, who are you exposed to, how did it happen. So have these things ready to go. Employees so appreciate it when you do this. And we always have in our OSHA manual right in the front, stapled together, the 3 forms, a map and a phone number and a contact name at the occupational medicine clinic. We have it ready to go. So again, they're going to look at the source patient, they're going to look at your employee, they're going to check the blood of both, they're going to give post-exposure prophylaxis if it's needed. For example, maybe an immune globulin injection, and then they're going to follow that person up. So you don't have to do that, okay? It'll be out of your hands. You're handing off that ball. So once the employee is gone there, this occupational medicine clinic will give you a written opinion. It's basically going to say, look, we're treating the patient, the employee. We're going to follow them up and treat any medical conditions that need treatment. So you know they're in good hands. The employee knows that you've put them in good hands, and they all appreciate that. Now, as I said in the beginning, a big violation, the number 1, was not having a written written hazard communication plan. That's all about what? Chemicals, products, materials. Violation number 8, not having a written exposure control plan. Exposure control is for exposure to bloodborne pathogens. So it's required to have. It needs to be accessible. And if a properly designed one will definitely decrease potential occupational exposure. So dry throat, let me get a little water here. So some of the things you need to have in the plan. Identifying the hazards in your office, the tasks you have that could cause potential exposure, which employees could be potentially exposed, which PPE they need to use. Also, information on the standard precautions that you use, the engineering and work practice controls that you employ. Housekeeping, what type of housekeeping do you do? What type of things do you do to clean, disinfect, sterilize? Hepatitis B immunization, how do they get it if they suddenly decide they want to get it? Post-exposure evaluation and follow-up, we just talked about it, but how do they access that? So all of these things need to be in this written exposure control plan. So you can imagine OSHA is not too happy when they see you don't have one. So again, which workers, in my mind, in my experience, everybody in a dental office has exposure. Yes, the clinical people like doctors, assistants, hygienists have more, but front desk people, it's not like we're in, Tampa General Hospital where the 6th floor is all admin. In our offices, they're kind of like small mini hospitals. Even our front desk people may have exposure. So we identify the people and the procedures we do that may have exposure. And of course, we really focus on standard precautions. We really want to, in our exposure control plan, emphasize to employees, look, doesn't matter if it's your best friend from high school, your pastor, your rabbi, your family. We do the same thing for everybody. Same PPE, same sterilization, same disinfection. That's the basic description of standard precautions. And engineering controls, what engineering controls do we use? in other words, engineering controls are mechanical devices that you would use to make the office safer. So which ones do we use? Training on them. And also, this is a really important thing. We have right in our exposure control plan multiple blank paragraphs for each year because you are supposed to review new technologies annually. Now, that doesn't mean you need to make a change. You're probably doing a good job. But this once a year meeting with all departments, you need to at least talk about, hey, what can we do to make it safer? Maybe you have a new hygienist that says, I'm just coming up with something here. You know, here we use the single-handed scoop technique to recap needles, which is, by the way, fully compliant. I worked in an office where they had this really cool needle recapper. It worked great. I felt it made it safer. Or maybe you call up Darby and give one a try. Give it a try. So, but talk about these things and make notes on it, even if it's just a couple sentences. This is something OSHA looks for. And they also look for this written housekeeping schedule in your exposure control plan. In other words, I think I have a picture of one here. Well, what do you do? Daily, weekly, monthly? What disinfectant do you use? This is how people get on the same page. This is how you get so you don't have in room 1, the assistant's putting a barrier cover on the light handle. And in room 2, they're wiping it with your cavi wipes. So this is how we get consistency. They also want to know about regulated waste. Now, before we talk about regulated waste, let's talk about non-regulated waste, because a lot of times people don't realize that most of what we generate in the office is just regular trash, which also is known as non-regulated waste. So you can dispose of that out in regular trash in the dumpster. And that's most of what comes out of our office. What is not regular trash, what is regulated waste, one thing would be sharps. So you want to make sure you have a sharps container in every room. I know all of you have sharps containers, but the OSHA regulations say, I'm paraphrasing, shall be located in the area of use. So I would like to see you have these 1 quart or 2 quart sharps containers in every room, rather than just one big one in the back. The other thing I'll see is overfilling these things. It's a shame when you see people doing the right thing, they get an overfilled sharps container, they get a needle stick because they're trying to squish these needles in there. When it gets about 7/8 full, seal it up, go to a new one. With PPE, the employer, of course, needs to provide it. They need to make sure employees are wearing it. They need to make sure they have it in the right sizes. And people need to know you can't wear this stuff home. You can't wear this into the lunchroom. If employees want to wear short sleeve scrubs to and from home and wash them at home, that's fine. As long as they've got something that's long sleeve, high neck, that's left in the office and either laundered in the office or picked up by a laundry service. This is a violation I see all the time. So you could do what we do. For years, even before the OSHA regs, I always wore long sleeve scrubs. I left the scrub pants, the long sleeve scrub top, and just a pair of inexpensive tennis shoes at the office. I didn't like to bring that stuff home. You don't have to do that, although I think it's a great idea. But a minimum, you need to be leaving a long sleeve, high neck, knee length lab coat at the office for washing. Now, another thing that you can imagine we have seen a lot of are COVID related. And I wish I could take out this slide that we didn't still have to deal with this, but we still do. And we probably will for just a little while yet. And last year I saw a lot of this. Someone comes in and first of all, they find out that they're not wearing an N95 respirator when they should. But you probably know that. But here's a problem that I see. If somebody's wearing an N95, not conducting fit testing of respirators. So if you're going to wear them, you need to make sure they fit. OSHA will look for that. Not having a written respiratory protection plan. Easy to do. It's something you can download from our website just as a courtesy. It takes about 5 minutes to fill in, maybe 10 minutes, but you need to have a written respiratory protection plan. OSHA looks for that. Not having a medical evaluation for the people who wear these N95 respirators. You can go, I'll show you our website in a little bit, but you can go to our website and actually download the link to the 3M medical evaluation. It can all be done online, cost about $30 an employee. And again, you just need to do that for those employees who may have that exposure. Now, OSHA is all about employees. Keep in mind, OSHA doesn't care about our patients. A lot of times people don't realize that, but OSHA is only about employees. So everything I've talked about tonight, chemicals, blood, sharps, that's all for our protection, for our employees' protection. Now, the good news is this emergency temporary standard, which applies to a lot of healthcare facilities, no longer applies to us if we're screening everybody who enters. Now, when I say screening, you don't have to do the temperature check anymore. That's optional. Probably not a bad idea. We bought all those thermometers, right? And they only take 5 seconds, but you don't need to do it. What you need to do is ask those basic questions. You know, if you've been around anybody with COVID, do you have any symptoms, and go through the symptoms. It's important you still screen people. The only dental offices that would still fall under this emergency temporary standard would be if you do treat known or suspected COVID-19 patients, but I don't think that's anybody on this webinar. That would be a hospital-based practice where you have a negative air pressure room, where you would treat, for example, TB patients or COVID positive patients. I don't think that's us. That's that's probably not anybody on here. And if there is, and you ever have questions about that, you know, we're glad to help you at Compliance Training Partners. You can always give me a call. So imagine now that if you are screening everybody, you're exempt from the emergency temporary standard. So in a couple slides from now, I'm going to show you what you do have to do. The nice thing is you can make some of the decisions. So screening is important. When I say screening, I mean not just patients, but the repair people who come in, you know, the plumber who comes in. So following OSHA regulations and CDC guidelines, it's always been important, but make sure that you have this COVID hazard assessment, this COVID-19 safety plan. Again, just invite you to click on the Learn More button at Compliance Training Partners. All those things are there for you to download. So this, to me, is an important slide because I'm assuming everybody here is either they were or they are going to start screening anybody who comes in the office. Again, we're talking about a screening that just takes, 30 seconds. But if you've done that, now you can make the decision what kind of PPE you should wear. The first thing I would do is consult this COVID data tracker. This was from a while ago where everything was red. Substantial is orange. Substantial transmission rate is orange. High transmission is red. Now the rules are a lot different if you're in a community that has substantial to high transmission versus if you're in that blue to yellow, which is low to moderate. So you can look up your community's level of transmission. The good news is these levels are going down all the time. And here's what we want to talk about next. If you're performing an aerosol generating procedure, now we're talking about using an ultrasonic scaler, using a high speed, using an air polisher in hygiene, using air abrasion, maybe for restorative, using a high-speed handpiece, air water syringe. These all create aerosols. These are aerosol generating procedures according to OSHA. So if you're screening patients, you don't suspect they have COVID-19, you need to wear the recommended PPE, which would be a NIOSH approved N95 or equivalent. And when I say equivalent, I mean, for example, a KN95, a KF94. The KN95 is approved in China, the KF94 in South Korea. So you need to wear an N95 or equivalent if you're in a county with substantial or high levels of transmission. If you're not, you can be wearing your regular surgical mask, your level 1, 2, or 3, okay? I really prefer level 2 or 3 for dentistry. If you're wearing a respirator, again, if you're wearing an N95 mask, it's considered a respirator by OSHA. So again, make sure you have this written respiratory protection plan, the fit testing, the medical evaluation. If you're in this substantial high level of transmission, also make sure that you're wearing a face shield or goggles rather than regular safety glasses, okay? Once you know that you're in that low to moderate, you don't have to. So what I like about this is you can use your professional judgment based on the levels in your community to determine what you wear. And I like that when we have that control. People ask about masks, cloth face coverings. Again, a face mask with cloth face covering still needs to be worn at all times in the dental office. It's not like going into Costco where it's optional now. You have to do it. This means business office staff as well. Remember, you can wear cloth face coverings in the office, even doctors, until you start to treat patients. If you're doing direct patient care, you need to switch to a surgical mask. So make sure that PPE training is there. In other words, people know what PPE they have to wear, how to dispose of it, how to disinfect it, how to put it on, how to take it off. And when I say the limitations, I mean, like the previous slide, a cloth face covering, that's great, but it won't protect you in an aerosol generating procedure. Now, some other key areas that people need to be aware of, although the things I'm showing you were the top violations that we saw last year, I want you to realize that OSHA is more than just those. In an inspection, remember, they're going to look at these other subparts of the regulations, like you might think non-ionizing radiation, why would I have to worry about that? Well, we have some things in most offices that produce non-ionizing radiation. We all have curing lights. That's considered non-ionizing radiation. And lasers are. Also your electrosurge. Fire safety, electrical safety, first aid. So just keep in mind, again, this webinar is not designed to teach that. This isn't your annual training webinar, but I just wanted you, even though I've gone over so far the most common violations of last year, I just want you to really realize you need to be in compliance in these areas as well. Now, since we're talking about inspections, and I've got to tell you, a big part of doing this training is just general safety. I mean, it makes the office safer. But I want to talk a little bit about OSHA inspections. And first thing I want to say, maybe the first time you've heard this, but OSHA inspectors are actually pretty fair and pretty reasonable. The ones I run into are pretty reasonable. If you're doing the things we were talking about, like a written hazard communication plan, a written exposure control plan, a safety data sheet binder, and you've got records of training, wow, right away, they're like, this is a pretty good office. I don't think we have a problem here. They're going to look for the posting of required documents. They're going to talk to employees. They want to make sure that employees, in fact, have been trained, that they know how to find a safety data sheet. They know where their eyewash is. But they're going to walk around, make some notes. And if you're doing the things I'm talking about here today, tonight, you're just not going to have a problem, particularly if you're doing the annual training and have the written programs. Most inspectors are quite reasonable. And even if they make a mistake, if a citation is issued and they were wrong, well, you know what? You've got a couple weeks to contest it. And that's one of the things that our company does. We help Darby clients out with that by helping them write those letters of contest after an inspection. And at that point, you're not dealing with that inspector, you're dealing typically with their boss at a higher level. If they've made a mistake, that can be rectified, that citation can be eliminated. But again, you got to do the things on this slide for you to have a chance at doing that. Now, CDC guidelines, I just want to mention that OSHA can enforce them. A lot of people think they're not important because they're guidelines, they're not law like OSHA, but your state dental boards, in fact, enforce them. Public health departments enforce them. And should you be unlucky enough to be in front of a jury or judge, believe me, the public and the courts of law expect you to follow CDC guidelines. Now, you might say, if I'm going over these things tonight, giving you an idea of where things went wrong, how can you be in compliance? One of the things that we are going to do to all of you, to everybody who attended, we will make sure that we send you an OSHA compliance and an infection control compliance checklist. This is something that you're going to want to do once a year. I would put it in the hands of whoever you put in charge of OSHA and infection control. Again, typically a trusted clinical person, and make sure that they go through this. Any of the areas that are listed as no, you're going to want to go through and then write the date that you abate that when you make those changes, and keep these audit checklists. OSHA inspectors love this when they see that you've got a methodology that you're going through and making corrections and improving. I've seen so many times offices that an inspector goes in, they see that, okay, maybe they didn't train that new employee yet, they've been there only a week. Couple SDS sheets missing. Eyewash hadn't been checked in a month. But if they see all the other things are good, they usually cut you a little slack and will say, look, get that corrected, send me documentation that's being done, and we don't have a problem here. But I just really implore you to do these things so that you can have a good experience should you ever have an inspection. At the same time, you're going to protect liability for your business. So the things that I mentioned on here, particularly on our Learn More button, you can go to compliancetrainingpartners.com and download that information. It's just free for the taking. And there's also some good videos and training things on there that you could use maybe at your next staff meeting. Now, I want to thank you for attending. I really appreciate you coming out and your interest in safety. Someone asked here, it's a good question. Can the inventory list be shared in a drive accessible on every computer in the office? Yes, it can. What I'd really like to do though, let's say if it's on a Google Drive, okay, that means you do have the ability to print it out to put it on the wall. OSHA loves it when they see stuff like that. But I love the idea of sharing it on a Google Drive. That's a really practical way for everybody to see it. It's a great idea. What kind of form is required by OSHA to show that TB testing was completed or refused? That would simply be a copy of that TB baseline test. If someone refuses to take it, that's a real problem, because when you stop and think about it, if they were TB positive, that could be putting your patients at risk. So a TB baseline test, proof of it should be in the employee medical record. This doctor asked if they could get a copy of the slides. I'm quite certain, am I right, Dan, that this webinar will be posted? Am I correct about that?
Yes, we will post this webinar. And all folks need to do at this point, you have the code up there. They can go get their CE credits. I know based on states, they may have to take a short survey, correct?
Yes, and of course, be really careful. This is live. The great thing about tonight is because we're doing Q&A and I'm actually not recorded, it's really me. It's like we were doing a live seminar, so it's live CE. And of course, states only accept so much recorded CE. This is another really good question. We have some temporaries coming in. Are they covered by the temp agency as far as trainings, et cetera? That's a great question, because I've been involved in OSHA inspections in almost all 50 states, in US territories like Guam, US Virgin Islands, Puerto Rico, and they're all the same. And I've seen a number of them where they key in on temps. Now, technically, if I work for XYZ temporary agency, they're my employer, you have me come in for the day. Technically, the employer, XYZ temporary agency, is responsible, right? They certainly need to have provided me with OSHA training. I need to have a certification of that. But whenever you have a temp come in, I realize you can't sit down and show them the online training for 3 hours. I know you can't do that. Give them just a quick 5-minute, here's the eyewash, here's the safety data sheet, This is Mary, our hygienist. She's in charge of OSHA and infection control. If you have any questions, here's where our PPE is. I mean, just make sure there's at least an orientation, because you could be pulled into it. Technically, it is the responsibility of the employer. Why send both a patient and exposed employee to the medical clinic for testing? Can we just send the patient to ensure there's nothing in their system and update the employee? You're right. If you send the patient there, the rapid hepatitis B, C, and HIV test come back negative, the employee can rest easy. But it is in the OSHA regulations. You need to ask both to go. Either can refuse to go, but they both do need to be offered the opportunity to go. Someone says here, can I clarify dental scenarios where dental personnel must wear the respirator versus preferred use under the mini RPP? Well, what I'll say is this. Let's just say if I'm in Wayne County, Michigan, I'm going to look up each week on the CDC COVID data tracker my level of community transmission. If last week I was in the substantial area, I am going to wear, even on a screened patient, an N95 and my face shield for that composite filling I'm going to do if I'm using the high-speed handpiece. This week, it's gone down to moderate. I don't have to wear that anymore. I can go back to a regular safety glasses and mask, like a level 1, 2, or 3 mask. Someone here, a hygienist asks, screening patients don't get a mild case and there's a lot of aerosol with drills. I'm not sure what that question means. It says screening patients doesn't get a mild case and there is a lot of aerosol with drills. I'm not sure. Sorry, I wish I could answer that, but I'm not sure what I mean. Can you find written programs online? No, that's something you'd either write yourself or purchase. Should a doctor bring his dog into the office and let it run around and lay on the floor in operatories? You know, this is just me, Darcy. I love dogs, but I do a lot of traveling. At least I used to do a lot of traveling doing seminars. But these security animals do drive me crazy. And do I think it's a good idea to let a dog run around in the operatories? I think it's a potential public health violation. I think that's the sort of thing that you just don't need to do in a dental office. This is my opinion. This is my opinion on this now, is that a patient doesn't think it's cool that there's a dog in the office. They call the public health department. The public health department kind of has an affiliation with OSHA inspectors too. It could generate a lot of bad stuff for the office. I don't really like it. Even though I love dogs, would I bring my dog into the office? No. I think it's a mistake. Is hepatitis B vaccination mandatory for administrative staff? Now, technically, it wouldn't be if you never touch anything clinical. But here's what I find in most offices, including mine, you've got an administrative staff that, for example, 2 people at our front desk used to be assistants years ago. Guess what happens on a day when somebody's sick? Particularly during COVID, where we didn't want anybody who had any respiratory symptoms to come in. Okay, we had our front desk staff pinch hit. Or the last instrument stick exposure incident we had in the office was when one of our front desk people, we asked them to go back on a super busy day and scrub some instruments and load the ultrasonic. So unless they absolutely don't touch anything clinical in the office, I really think that they should be immunized. If they absolutely only have an admin job, you could make a case for not doing it. Nicole asked, what is a spill kit? I would make sure that you have a spill kit available. It's something, again, you can get from Darby, where you actually have your PPE, your powders, scoops, everything ready to go, disposal bag, should there be a chemical or biological spill. Lisa asked a really good question. A lot of people want to know about this. Are anesthetic carpules considered regular trash or need to be placed in sharps containers? Blood in them, is another question she asked. Well, first of all, if an anesthetic carpule is fully empty, you really have two choices, two things you could do that would be perfectly within the law. One, you could do what we do. I put it in the sharps container. If it's empty, no blood in it, no anesthetic in, because I don't want to mix categories of waste. If I have drug in it, if I have anesthetic in it, I can't call it just a sharps. Now it's, chemical waste. So an empty carpule, I like to put in the sharps container only because, let's face it, they can get in the dumpster. Maybe somebody's dumpster diving, they cut themselves. I just like to put them in there. But it'd be perfectly acceptable to put empty carpules in regular trash. It would. What about if you're not through a temporary agency? I'm a hygienist who temps various offices. That's interesting because Sherry, you are actually, I'm assuming you may be formed like an LLC or something. You actually are your own corporation. So you are an employee of that corporation. So make sure that you somehow document that you have OSHA training. But then to protect yourself, when you go into offices, I would ask them, look, can you just tell me, I need this PPE or I need that, or who do I see if I had an exposure incident? Just ask them for a quick tour, a 5-minute tour of the important things. But make sure you document that you, if you're your own employer, do have OSHA training once a year. Because again, you are an employer of that corporation. People ask this all the time, Cheryl, what if our eye wash is a sealed bottle on the wall next to a sink? That absolutely won't fly. And I don't know why they even sell these squeeze bottles, because by definition, you have to have an eye wash that's binocular, that can deliver half a gallon of water a minute for 15 minutes. So you really need to have a real eye wash. I've seen fines over the years many times for exactly what you're talking about, one of these small bottles. What's the OSHA requirement for solo practice? No employees. Well, Rosanna, if you're practicing solo, literally just you, I guess what I would say then is, are you a sole proprietor or are you a corporation? If you are a corporation, you are an employee of that corporation. So you need to do the things I'm talking about. If you are a sole proprietor, you're not an employee, you really wouldn't have to do those things. Obviously, you'd still have to follow infection control guidelines, of course. For COVID, do we need to have employee medical evaluations completed annually or just one time? Annually. They do need to be done annually. Just like fit testing needs to be done once a year, annually. Roya asked, how can I find about the category of my county? CDC really did do it right. If you go to CDC COVID data tracker, now it'll say pick your state, then it'll say pick your county, and it will actually show you which level of transmission you're in, and monitor that weekly. Someone asked here, what kind of record keeping is required for a fit test? That's just really, it's just really filling out go, no go is really what it is. There's qualitative and quantitative fit tests. And really what you'd be doing, and you could purchase one yourself and do it, save the money, do it in your office. You can buy a qualitative fit test, and it's basically go or no go. Either you smell it or you don't. And if you don't smell it, you've got a good seal. Well, with that, you guys had a lot of questions. I really appreciate that. That's how I know people really listen. We do appreciate it. And again, thank you to CareStack and Darby for doing this. And thank you everybody for attending. It was a really good webinar. We had a lot of people on here, and I hope it was helpful, and I hope we'll see you on a future webinar.